eating well, not drinking too much, taking exercise. For me, I found that running has been brilliant. It's been really good for giving me just a bit of headspace. I can just get out of the house for half an hour and just run through a few things. And it also is really good for dealing with my sort of edginess and my breathlessness that still kind of hang around as a bit of an aftermath of anxiety.
Things like attending appointments and making sure that you're fit enough yourself so you can do your job to care for others properly. Although it may not have to be your responsibility, it is your responsibility, and you just have to do the best you can to make sure you're well enough. Because if you're not well enough, then it's absolutely useless.
Self-care is something which, even though it's not really been recognised that much, I think it's a really important aspect of caring, and it sort of forms the basis of what how the NHS operates, really, to a certain extent.
For me, self-care is really about what we can all do in our day-to-day lives to look after ourselves. I think we all make choices about what we eat, the exercise we take, how we unwind when we're stressed, and I think at its most simplest it is absolutely within everyone's gift to consider those choices and to make them part and parcel of the way they live their lives.
Self-care is about people being in charge of their own health and well-being and their own care and looking after themselves, really. And I see statutory services and the third sector as being there to help and support them to get the services and the care that they need.
When we're talking about self-care, for me it's about people having the skills, the confidence and the knowledge. Quite often they've got knowledge but they don't realise that they have, because we have this old model that says actually the consultant or doctor knows best. Only they know what it is to live in their body, their life with this disease or ailment, and we in health can facilitate that knowing so that they're able to step up, step forward and take much more active part. We have a healthcare professional working in true partnership with a patient or a carer.
What we want to do is to support people to take control of their illness, to understand what their strengths are and to build on those strengths in order to more effectively manage all areas of their lives and live as fulfilling a life as they can despite the illness.
You're able to take positive action that can help you to maintain your health and well-being, even if you have, for example, a long-term condition. So obviously from that carer point of view, their contribution to self-care would be around the person that they're caring for and working together with them to make sure that they can be as healthy as they can be.
Well, it takes the onus off statutory services to do things to people, and it helps people decide what they need to help them to be the person they want to be, to live the life that they want to live in the way that they want to live it. And it helps us to design services and commission services that really reflect what works for the people who use the services rather than what we think theoretically will work on a piece of paper.
We've spoken to a lot of carers who often say they don't have enough time for themselves, and actually building that in terms of our redesign of services will actually really help us keep carers caring, and that's going to be critical for the sustainability of the system overall. I think where we've often not necessarily been clear with patients is often we find ourselves delivering particular interventions and not spending the 10 or 15 minutes to actually say then, okay, well, which bits could you do for yourself? And more importantly, we often hear both carers and patients saying they would happily do more, but they'd like some time up front to be educated and trained about what works. There's so much information out there, it's often very confusing. People want a trusted source to go to. So I think we often put a catch-all around self-care that actually makes it seem very simple, and I think possibly the information is, but how you get it and how you use it is time that you need to spend with people so that you get the best from that.